One of the things that struck me was people were, there was some research saying that there's 1 in 5 people are lonely. That's 20% of our population. And there was also some other figures come out from Concern UK saying that there was 1 million people who hadn't spoken to anyone in over a month, that be it relatives, friends or anyone. And I find that quite shocking in this day and age. In terms of loneliness, I work in mental health, and obviously loneliness has a real impact on people's mental health, also physical health as well, because you're more likely to maybe take alcohol or use drugs or other kind of unhealthy behaviours just because you're lonely. I just think in this day and age, it's a travesty. And it doesn't discriminate with age. We always think that it's just the elderly people that are lonely, but children and young people can be lonely as well for a variety of reasons. Be it bullying, loss and bereavement, or just not fitting in. And I also seen some other research from the Mental Health Foundation, which says that people between age 18 to 35, I think it was, worried more about loneliness and actually displayed loneliness, more than the over 55s. So again, it's right across the life course, and it's not just elderly. Well, I work for NHS Greater Glasgow and Clyde, and we cover 6 community planning partnership areas, so it's a really wide geographical area that we cover in Greater Glasgow and Clyde. There's a variety of initiatives going on in Greater Glasgow and Clyde. In Renfrewshire, we're just kicking off a piece of research, peer research, working with the University of the West of Scotland, and using a peer approach to find out, what are the issues of loneliness in Renfrewshire. Where are the gaps, what are the services, etc. So hopefully that will report in sort of March time. In areas of Glasgow, we've got an initiative called Thriving Places, and that's in some of our most deprived areas of Glasgow. And although not badged as loneliness projects, there's a range of initiatives such as peer support clubs, homework clubs, lunch clubs, cafes, men's sheds, Manathon, which is a men's health project, and just really that kind of social connectedness. I think if we badged it as loneliness, then that further perpetuates the stigma of loneliness. So I think we need to be creative. Also in another area of Greater Glasgow and Clyde, Barhead, and it's a men's shed, but there's women go to the men's shed as well, so we're not sexist there. But the thing that struck me there was they were given premises, and for whatever reason there was a technical hitch and the premises were taken off them, and people were just saying, that was my lifeline, that got me out the house, it got me people to speak to, I was able to connect with people in the local area. Because the building was taken off them, they then just started meeting up in a cafe. They're hopeful to get the building back again and further build that up and make further connections within the community. So there is a range of initiatives going across. I would like to see that we don't medicalise loneliness. If we stick another label on it, then we further stigmatise it. I think we should be using asset-based approaches. I think we should be raising awareness of loneliness. I think we should be using what's already happening in the community and try and connect people in. A simple hello to somebody can mean the world. So really it's about using those approaches and just not ignoring that loneliness is an epidemic in this society.